5 signs an elderly person may be in their last year of life. Subtle warnings you shouldn't ignore. Has someone you love shown subtle but worrisome changes in the last year? Many people believe that death and old age come suddenly, but in reality, the body often gives silent warnings months, even a year, before life reaches its final stages. The problem is that these early signs are easy to miss because they seem minor or unimportant at first. Often, it's only in hindsight that families realize the clues were there all along. By then, it's too late to prepare or make those final memories meaningful. In this video, we'll discuss 5 key signs that may appear in the year before an older person's death. Some of these you've already noticed but dismissed as normal aging. Others may seem minor but are actually signals of the body's slow decline. Recognizing these signs early gives you the opportunity to provide the best care, create meaningful moments, and most importantly, ensure that the final chapter of your loved one's life is filled with comfort, dignity, and peace. Stay with us until the end, because understanding these 5 signs can help you prepare, both emotionally and practically, for what lies ahead. You won't be caught off guard, and you'll be able to make the most of the time you have left with the people who matter most to you. Let's get started. 1. Significant weight loss. One of the earliest and most telling signs that a person is approaching their final year is unintentional weight loss. It can start subtly: a belt that fits looser, clothes that hang looser, or a noticeable drop in appetite. Families often dismiss it as just part of aging, but in most cases, effortless weight loss is a warning sign. It can be a sign that your body is no longer absorbing nutrients. Muscle mass begins to decrease, and your major systems begin to slow down. While aging naturally causes some muscle loss when it happens quickly, it indicates something deeper. Your body may have difficulty digesting food or processing protein, causing muscle loss. This weakness affects more than just mobility. It increases the risk of falls, weakens your immune system, and increases your chances of infection. Another reason for weight loss in old age is decreased appetite. Many older people no longer feel hungry as much as they used to. Food loses its flavor, portions become smaller, and some even skip meals altogether. It's not a matter of preference, it's your body signaling that it's starting to shut down. There are hidden health issues too. Chronic illnesses like cancer, heart failure, or kidney disease can trigger weight loss months before more obvious symptoms appear. Even depression or early cognitive decline can cause food intake to decrease and lead to dangerous falls. While families often respond by offering favorite foods or supplements, if weight loss continues, the problem may be more than just diet. Instead of pushing for large meals, focus on comfort, hydration, and easily digestible foods. If you notice significant weight loss, especially when accompanied by fatigue or decreased activity, this is a message from your body. Understanding this message early on can help you prepare with clarity and compassion. 2. Extreme fatigue and weakness. Another common sign during the last year of life is a deep, persistent fatigue that does not improve with rest. This is not just tiredness, it is exhaustion so severe that even simple tasks become difficult. Getting out of bed, going to the bathroom, or talking may seem unbearable. This level of fatigue goes beyond normal aging. It is a sign that the body is conserving energy as organs begin to slow down. The heart may no longer pump blood effectively, oxygen circulates less well, and muscles become weaker. When the body enters this state, it begins to prioritize basic functions over movement and activity. This slowing of metabolism also means that the person sleeps more, takes longer naps, and struggles to stay awake for long periods of time. Some may seem alert for a moment, then suddenly become exhausted. Emotionally, it can be just as difficult. Older adults who were once independent may feel frustrated or embarrassed by their limitations. This may lead to them withdrawing from conversations or activities, not because they don't care, but because they simply don't have the energy. This often creates a cycle of isolation, with the person withdrawing even more, further exacerbating the decline. This can be difficult for families to watch. You can encourage them to be more active, but the most important thing you can do is respect their limitations. Be patient with them, offer comfort, and prioritize quality time without pressure. If your loved one is experiencing persistent fatigue that doesn't respond to rest, their body is likely going through significant changes. This is a time to offer peace, presence, and unconditional love. 3. Increased cognitive confusion or detachment. Changes in thinking, memory, or communication are another strong indicator that someone may be entering the final stages of life. A PA person who was once quick-witted and engaged may begin to forget details, repeat themselves, or become disoriented, even in familiar places. They may lose track of time, forget names, or have difficulty following conversations. This is more than just everyday forgetfulness. The brain, like all organs, requires a constant supply of oxygen and nutrients to function. As blood circulation decreases, the brain begins to slow down. The person may become confused, indecisive, or even fail to recognize people they have known for years. You may notice periods of clarity punctuated by sudden confusion. This can be especially disorienting for families, as the person seems fine one moment and lost the next. Along with memory problems, emotional detachment is common. Conversations may seem exhausting, and social situations may seem overwhelming. Older adults may become silent, not because they don't love you, but because they can't process interactions the way they used to. Some become irritable or anxious, while others seem distant or indifferent. These changes often reflect the brain's slow adaptation to decline. Emotions become harder to express, and reactions less predictable. Watching a loved one decline mentally or emotionally can feel like a loss before the real goodbye, but try not to take it personally. Instead of trying to bring them back to the present, meet them where they are, speak softly, offer comfort. Even if they don't respond, they still feel your presence. If you notice increasing confusion, forgetfulness, or detachment, don't ignore it. These are common signals from the body and mind preparing for the transition. Now is the time to be patient, provide closeness, and create peace. 4. Frequent infections and slow healing. As the body slows down, one of the most obvious signs is a weakened immune system. You may notice that a loved one who rarely got sick now catches every cold, flu, or infection. Minor illnesses linger, and small cuts or bruises take much longer to heal. This is no coincidence. The body is losing its ability to defend itself and repair itself. Repeated infections, such as UTIs, pneumonia, skin problems, or mouth ulcers, become common. Many families treat each illness as a separate event, but when these infections begin to occur more frequently or take longer to heal, it is usually a deeper signal of decreased immunity. Even antibiotics may become less effective, requiring longer or stronger treatments. Meanwhile, circulation slows, and wounds may reopen or fail to heal, especially if the person is less mobile. Bed sores become a serious risk. Infections don't always come with the classic symptoms either. For older adults, a sudden drop in alertness or interest in food may be the first sign that something is wrong, even before a fever sets in. For families, recurring illnesses can be both debilitating and heartbreaking. You want to fix it, but at some point you may need to shift your focus from treatment to comfort. Simple actions, keeping the person clean, hydrated, and relaxed, can do more than another trip to the hospital. If you notice recurring infections, poor wound healing, or mental decline, these are signs that the body is becoming increasingly vulnerable. Now is the time to prioritize peace and support over more intervention. 5. Significant changes in breathing or circulation. Finally, one of the most noticeable signs that life is approaching its final phase is a change in breathing and circulation. You may notice that your loved one is breathing more slowly or irregularly. Sometimes there are long pauses between breaths or a pattern of rapid breathing, followed by silence, known as Cheyne-Stokes breathing. These patterns often begin subtly but become more noticeable over time. Meanwhile, circulation also weakens. The hands, feet, nose, or ears may feel cold to the touch. The skin may become pale, bluish, or mottled, especially on the fingers and toes. This occurs when the heart diverts blood flow to the vital organs and away from the extremities. Shortness of breath is also common. Even simple movements like sitting or talking can cause someone to become short of breath. Breathing through the mouth becomes rapid, and lying on the back can be uncomfortable. This may be due to fluid building up in the lungs, which can cause coughing, gurgling sounds, or chest tightness. These signs may seem alarming, but in many cases they are part of the natural slowing down process. Families may feel a strong urge to act, to help, but the priority right now is comfort. Keep the room cool, use a humidifier, and offer water as needed. Medication or oxygen can help ease breathing, but the goal shifts from fixing to reassuring. If you notice difficulty breathing, cold extremities, or bluish skin, these are signs that the body is conserving energy. Now is the time to offer comfort, be there, and help your loved one feel safe and calm. Final thoughts. In closing, take a moment to reflect. Significant weight loss, profound fatigue, declining cognitive ability, frequent infections, significant changes in nutrition and circulation. These 5 signs often appear in the last year of an older person's life. They may not all appear at once, and they can be easy to miss. But when they do appear, they are often the body's quiet way of preparing for the end. This can be a painful realization, and many families instinctively want to fight it, push for more activity, more food, more treatment. But sometimes the most loving thing we can do is listen to what our bodies are telling us. It's not about giving in, it's about shifting our focus, from treatment to comfort, from prolongation to care. Understanding these signs isn't about fear of death, it's about being prepared, ready to care with compassion, to say what needs to be said, and to ensure that the last months of your loved one's life are filled with dignity and love. If you notice any of these signs in someone close to you, take a deep breath. You are not alone. Others have walked this path, and while it is never easy, knowing what to expect can bring peace and strength. Thank you for spending this time with us. If this video was helpful, please leave a comment and tell us what stood out to you most. Your voice matters. If you would like to stay in touch, please consider subscribing and turning on notifications. We are here to support you with insight, care, and understanding. Until next time.